Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about osteomyelitis. Osteomyelitis is basically an infection of the bone. It's an infection in the bone itself. There are a couple different ways you can get osteomyelitis. One is by direct presentation. So if you have a wound or a sore over the bone, you can actually get direct entry of the infection to the bone, and you can get a secondary bone infection. What many of the studies have shown, that if you can probe through a wound to the bone, the chances of osteomyelitis go up significantly. So if you have an infection, and if you have a open wound, then you worry about osteomyelitis or infection of the bone. Now, you can get infection of the bone through the systemically as well, through the blood flow, where you can actually get an infection that goes to that bone area as well. So you can get osteomyelitis secondary to a surgery. You can get osteomyelitis secondary to a wound. You can also get osteomyelitis secondary to injury, like a fracture or something similar. But the idea is the most common infection of the bone comes from a direct entry, where you can actually have an opening that goes right down to bone that can cause it. So if you have osteomyelitis, the process that we will go through typically is we'll do an x-ray, and sometimes x-ray will show osteomyelitis or show the indications that you have an osteomyelitis. You can do a bone scan, which is a nuclear scan where they're actually looking at the flow of the blood cells or the white blood cells to the bone, which can show that you have an osteomyelitis in that area. And you can also do a biopsy, where you actually do a surgically open it up, take a biopsy, send it off, and they can actually confirm that you have osteomyelitis or bone infection. Treatment-wise, there are really only two options. One is you treat it with long-term antibiotics, usually IV antibiotics, where you can actually treat it for at least 6 weeks. And over this period of time, you're treating the osteomyelitis and trying to get the infection to go away through those antibiotics. And so it has to be the correct antibiotics to actually solve that problem. The other option is to do surgery. Osteomyelitis can be treated very well through a surgical excision, where we go in and actually remove the infected bone. Sometimes you can, after the fact, cause it to heal through packing or other things like that. But the truth is, you want to remove infected bone. The only way it can be resolved is by removing it. So if you have osteomyelitis, if you are concerned that your bone may be infected, you should be evaluated and get it treated. Osteomyelitis is a big deal. It's a bone infection, and the way to treat it is to get rid of the infection, whether that's through antibiotics or through excision of the infected bone. This is Dr. Brandt Gibson, and this is your Podiatry Tips, Day 83.